if you're looking at it anatomically, yes, it could be, you're not breathing properly. It could be that you're holding your shoulders like this due to fear, due to anxiety, due to frustration, you name it. It could be all of those. It could be that you had an injury when you were a child, and that injury has become your Achilles heel now as an adult.
Welcome to the Radical Health Rebel podcast. I'm your host, Lee Brandon. This work started for me several decades ago when I started to see the impact I could make on people, helping them to identify the root cause of their health problems that no doctor could figure out, including serious back, knee, shoulder and neck injuries, acne and eczema issues, severe gut health problems, even helping couples get pregnant after several IVF treatments had failed. And it really moves me to be able to help people in this way. And that is why I do what I do and why we have this show. In this episode of the podcast, I speak with Margarita Bennett, a medical intuitive and craniosacral therapist. We discuss Margarita's extensive journey in health and wellness, focusing on the importance of fascia, the psoas muscle, and the biofield in relation to emotional and physical health. The conversation delves into how unresolved emotions can manifest as physical pain, the significance of breath in healing, and practical steps for individuals seeking to improve their well-being. Margarita emphasizes the interconnectedness of mind, body, and spirit, and the necessity of addressing all layers of health. Margarita Bennett, welcome to the Radical Health Rebel podcast. Thanks for coming on the show.
Thanks for inviting me.
Yeah, it's great to have you on. And it's interesting. We were talking before we started recording, and it's been a very, very long time since we last spoke, isn't it? I can't even begin to work out how long it was, but it was a long time ago.
Yeah, I think I was in my 20s.
So it was last year then?
Oh, bless you. But yeah, long time ago.
Yeah.
And it's lovely to catch up again. It's really nice.
Absolutely. So to kick things off, so the listeners can get to know you a little, can you share your kind of personal journey, your extensive academic and professional journey, to basically where you are today, working as a medical intuitive and a craniosacral therapist?
Okay, that's a long journey to go through. Basically, I started my career as a personal trainer, and I am incredibly inquisitive about the human body. I'm slightly obsessed by how it works and how the layers fit together. So from personal training, that led me to becoming a Pilates instructor to rehabilitate predominantly postnatal women. I worked with prenatal and postnatal at the time, really focusing on diastasis recti, prolapse, pelvic girdle pain, and overall just strengthening them and making sure that they could function after giving birth, whether through C-section or natural. And then after that, I realized I was missing more information, and I was constantly being told that you couldn't heal diastasis recti via fitness. And yes, of course, if it's an extreme case, it's a different story. It all depends on the quality of the fascia, of the connective tissue. But that led me to becoming a clinical massage therapist. I did a degree in clinical massage. And that encompassed, trigger point therapy, which basically looks at the Chinese meridians, myofascial release, and basically everything to do with rehab, disease, and chronic pain. And then from there, I needed more. I was hungry for more, and I wanted to learn about craniosacral therapy. I think that kind of was the layer that was missing, because it was the brain, the central nervous system, and the spine. So if you consider the lymphatic system, the muscular system, the cardiovascular system, I had learned all of those, but I hadn't learned fully about the brain and how that functions and how that impacts our system. And then obviously when you start entering the craniosacral world, you open many, many doors, because you're working with the layers of not only the central nervous system, but the layers of basically the biofield. The biofield is the auric field. And when I started working with that, it opened up my intuition quite drastically in a nice way. And that basically has given me the opportunity to become psychic. And I can see the system. I see the layers. I see people's history. I see people's emotions. I feel them. I sense them. I smell them. It really varies person to person, patient to patient, what comes in through the door and how the system wants to work. I don't get into people's systems. I allow the system to whisper to me what it wants and where it's at. So that's a very short, background about how I got to where I am.
Yeah, it's interesting you're talking about, working with sort of pre and postnatal women. I mean, I haven't kind of done that for some time, but I remember when I used to work with those kind of clients, I just found it so rewarding.
It was amazing. Absolutely amazing. I mean, I was running at the time, this was years ago, I created a class called Belly Buster. And I was having 9 women and 9 babies in the class. And loads of people would say, how does that function? Aren't the babies all kicking off? Because they're all different ages. So from newborn all the way to crawling age. Once they started crawling, I would say, I can't function anymore with that. But it was amazing not only to see how they developed, how they got stronger, but also with pelvic girdle pain. There's a lot of postnatal pelvic girdle pain that people don't talk about. And pelvic girdle pain, as well as prolapse, is basically a dysfunction in the fascia. And fascia is something that the medical industry doesn't really fully address. They don't see it as a whole. And I've seen amazing results with literally curing pelvic girdle pain, whether it's prenatal or postnatal, through fascia work, stretches, movement, breath, and trigger point therapy. So, yeah, I did my thesis for my degree, my medical thesis on pelvic girdle pain. And I'm very adamant. I saw 2 days ago a woman in the supermarket with crutches, and she was heavily pregnant. And I didn't want to intrude, but I felt so angry that they had given her crutches, because they would have said, well, this is just part of pregnancy. Accept it, let it go, and it'll go away once you give birth. And, sometimes it doesn't go away once you give birth, and you need the support, you need the help, and you need somebody to say, okay, this is what you should do to help it, and this is what you shouldn't do that can actually make it worse, for example.
Yeah, it's interesting you talk about pelvic pain, because I recently ordered a book on the very subject, and it's literally sitting on my bedside table. So I've probably got about 100 books that I've got that I haven't read yet. And I just put the ones that are kind of most urgent next to my bedside table. And I think it's probably third on the list of the ones for me to read. But it came highly recommended, and I'm kind of really looking forward to diving into that. So that'll be interesting. I'll let you know what one it is afterwards. I thought I hadn't ordered it yet, but I've just had a look. I've already ordered it, so I've already got it.
Yeah, do. And the thing with pelvic pain, whether it's male or female, sometimes it's not just in the pelvis. It could literally be the legs, the fascia from the legs and the adductors, the inside of your legs is pulling. And it, it starts pulling it down while the muscles at the top are too tight. So it causes pain in the pelvis. So it's looking at the whole pelvis holistically. It's actually looking at the whole body holistically.
Yeah, I mean, just looking at it from a physical point of view, there's a whole heap of muscles that attach to the pelvis from the legs, right? All the adductor muscles, just those on their own, right? And then you've obviously got the hamstrings.
And then if you add to that the psoas muscle, which is the internal biggest hip flexor, and if you have, for example, if you have IBS, if you have issues with your gut, the psoas will be impacted. And it's kind of chicken and egg. Is the IBS being caused because the psoas is too tight? or is the psoas too tight because of the IBS? It's sort of, and you need to address both.
Mm. Yeah, we'll probably come on to talk about that in a bit more detail a bit later.
Sure.
So let's start by talking about fascia. Now, as you kind of alluded to, it's pretty misunderstood by much of the mainstream kind of medical field. Can you explain what fascia is for the audience and why techniques like myofascial release or fascial unwinding are so important, especially compared to conventional kind of medical treatments?
Okay, it's very interesting because I look at fascia very, very differently from even the fascialists. So you have fascia is basically connective tissue. And the way that I like to explain it to patients is imagine yourself as a jelly baby with sticks in. That's basically what we are. Fascia is what holds and wraps around the cells of the muscles and wraps around your organs and wraps around your whole body, whether it's nerves, whether it's the cardiovascular system. It's basically, there's different forms of fascia. There's liquid fascia, what I call liquid fascia, which is not liquid, it's not water, but it's fluid. Or you can have, sort of tighter fascia, like the IT band is a type of fascia. The thoracolumbar fascia, which is on your back, is a type of fascia, which is a little bit more malleable. It's a little bit thicker. It's a little bit stronger.
Do you know, I've actually been to a cadaver dissection.
Okay.
And we were given the opportunity to actually grab hold of the thoracolumbar fascia and kind of pull it. And I mean, I was first surprised how thin it was, although obviously it's in someone that's passed away. I think they were 80 something. So it's very, very thin, almost like cling film kind of thickness. But I could have probably have picked the body up off the table from it because it's just so strong.
It's an incredibly strong connective tissue. However, what you picked up was just a layer. And this is why the medical industry finds it very difficult to work with. Because unlike the muscles that are layered, but you can sort of define them. And in reality, they were defined by Gray's anatomist, sort of the illustrator. But they were defined because of how the actual surgeon cut them. Okay, it followed the shape of the line. But they're not necessarily, they're so interwoven that they're not necessarily just like they are in an anatomical drawing. And it's the same with fascia. Fascia, prior to what we know now and the studies that have come up now, fascia was seen as padding during autopsies. So they literally just removed it and put it in the bin. They didn't realize the importance. It's like another organ because it's basically the in-between of not only the muscles, but it's the in-between of where your lymphatic system sits, as well as your central nervous system. So, sort of the actual fascia itself is where all the nerve endings actually finish in the human body. So it's quite a strong and important organ. I call it an organ. I see it as an organ. And when I work with it, I don't necessarily do it singly, as in, yes, trigger point therapy is a fantastic way of working, because trigger point therapy, it's sort of, it can look at the referred pain. So you might have pain in your hip, but it actually might be in your shoulder. The issue might be in your shoulder because of how the fascia is pulling. However, I have found now through the years that fascial unwinding tends to work much deeper than trigger point therapy or myofascial release. Because myofascial release, you're working with just the first few layers. But if you think that fascia goes all the way through you, and with 3D, you might have a fulcrum, which is basically a tightness in the fascia in, I don't know, at the top of your lung. And the pain might be in your shoulder. So how do you get through trigger point therapy? How do you get there? And that's through fascial unwinding.
Mm.
So fascial unwinding, if you were to consider this tissue, imagine that this is an arm, okay, and this is a healthy arm. This is an unhealthy arm. And then you can literally learn to unwind it like this to become back to a healthy arm. Does that make sense?
Mm.
Yeah.
Yeah. Yeah. I mean, we had a little bit of a discussion recently. It's actually the podcast episode that's out this week with my colleague, Matt Sorensen. So we were talking about visceral manipulation, and we kind of had a similar conversation about that. One of the things that I think, if someone's listening to this and they're thinking, still not quite sure what fascia actually is, I think for a lot of people, the most kind of obvious way to get an understanding of fascia, imagine if you've got a chicken breast and you're cutting for a chicken breast. There's kind of like a film or a layer that covers the chicken breast. Well, that's the fascia.
Absolutely. I give the rather than chicken, I use beef, because with beef you see it better. It's
Right.
the marbling.
Mm.
So when you look at a piece of steak, the marbling that you see that isn't fat, not the fatty bit, but the other, that's fascia. But on a dead piece of steak, it's solid. That's why when you look at cadavers, it's solid. However, on a live being, it's liquid. And the liquid means that it's not water, it's viscous. So it's like, if I can give you the analogies that I give to my patients so that they can get their head around. If you envision a toddler with a stinking cold and the bubbles that they produce, and they're really viscous and really sticky. So that's healthy fascia. That's how it kind of should feel, really movable. And at the end of the cold, it kind of gets stuck to their nose, and you can't just take it off with a tissue. You have to wet it. So that's adhesions. That's unhealthy fascia. That's dried up. So when you're working with, whether it's Rolfing, which is a type of myofascial release, or myofascial release, or fascial unwinding, what you're doing is you're bringing some movement and some more hydration into that connective tissue. So I always try and give visualizations that make sense to people.
Mm.
Hence the jelly baby with sticks in.
Yeah, it's interesting. I mean, I use active release techniques. I don't know if you're familiar with that.
I haven't heard of active release.
Yeah, but a lot of it is about releasing adhesions, myofascial adhesions, if you like.
And how does it work? What's the process?
So it works on lots of different types of tissue, but it's predominantly muscle, but it can work on ligaments, tendons. It can even work on the nervous system as well. And so what you normally do is you shorten the tissue.
Mm-hmm.
You then take a tension on that tissue in a specific direction, depending on what you're working on and where exactly it is. And then either passively or actively, you get the person to move. And so you're basically holding a piece down, and either underneath it or over it is now allowing to move. So it's kind of, it's almost like reducing the friction, let's call it.
Yeah.
And it is phenomenal. It's absolutely phenomenal technique. Certainly, it's helped me help clients that come in with problems that are incurable. Right. I remember working on one lady that had a year's worth of physiotherapy for carpal tunnel syndrome. Two sessions a week for a year, and I did a 10-minute treatment, and it was all gone, and it didn't come back. And I'm not saying that's going to be the solution for everyone, because it's not. But that was just one example of where, a very specific technique on very specific tissues, and obviously you have to know your anatomy very well to be able to perform that kind of treatment, can be very, very effective. I'm sure you've seen or experience similar situations in your work as well?
Massively. I find it amazing how something so, as you say, so simple, and obviously it depends on the patient, it depends on the condition, it depends on, sort of what's happening to their biopsychosocial situation. However, they go, this is magic, and it's like, no, it's not magic, it's just fascia.
Mm.
Sort of today I was treating somebody with frozen shoulder. She's had 2 treatments. She could barely move her arm when she came in 2 weeks ago. And she's able to move her arm this high. She can't go all the way, but we've only done 2 treatments.
Mm.
And it's the predominant work that we've done is fascial unwinding.
Mm. Yeah, again, I've had really good results with active release techniques for frozen shoulders as well. I actually worked on someone just the other week who's got a frozen shoulder, and she had 4 degrees of external rotation in the shoulder. I literally just did one technique, probably did about, 5 or 6 passes along a muscle, and she went from 4 degrees to about 70 degrees.
Wow. Yeah.
Again, it's one treatment. It's not gonna, the capture of the shoulder obviously goes around 360 degrees. And I was just releasing the fascia on one of the muscles around the shoulder, and it's going to take, I've worked with people with frozen shoulder before, and I can't remember exactly how many treatments it took, but I'm thinking maybe about 20 treatments.
But it's amazing to think that these poor people are left with a frozen shoulder for up to 4 years.
Mm.
And they get given painkillers, which then affects their gut and, constipation, etc. And then they start getting other issues because the fascia in other places start being impacted. And this is the thing that people are not putting 2 and 2 together. It's like, if one place is being impacted, it's going to have a ripple effect.
Yeah.
It's like I was working this morning with somebody who was diagnosed with trigeminal, the word is neuralgia, which is basically issues with the trigeminal nerve on the face.
Mm.
And she has an ulcer in her eye. And they just flippantly said that she has trigeminal neuralgia. And I was like, well, why don't we resolve the ulcer and see whether she still has trigeminal neuralgia? Because the ulcer could be impacting those nerves. But this is the thing, is that they seem to not consider the whole picture.
Mm.
And I get very frustrated with that.
Mm.
I mean, it means that I'm very busy in clinic, but I get very frustrated for patients around me. It's kind of, they don't need to go through so much necessarily.
Yeah. Yeah. It is very sad. It is very sad. No, I get frustrated as well. And I'm often the most frustrated when I'm working with someone and then they go and see their doctor for whatever reason. And quite often the doctor will say something along the lines of, "Oh, I hear you're getting better. That's really good. But it's definitely not what you're doing with this guy. It's got nothing to do with that. He's a charlatan." And you think, what? You haven't helped this person and you've been working with them for X number of years. They've been working for me for a few months. They're getting better every week. It's, there's a clear benefit, and you're saying it's not what they're doing with me. It must be something else.
Yeah.
That is frustrating.
It is very frustrating.
Mm. And then the other point that you was making as well, it's frustrating that people have to go through such, trauma, if you like, that's just unnecessary. But again, there's a part of me that doesn't blame medical doctors, because they're just following their training and they're following their guidelines. And if they don't follow their guidelines, they get their medical license taken away. I want to take a moment to share a story that really stuck with me because it's about more than just pain. Catherine was once a fit, active runner, but after a back injury, she could barely get out of bed. The worst part, she couldn't even pick up her toddler without wincing in pain. She felt helpless, exhausted, and scared of what the future might look like. Together, we figured out the root of the problem. Just 5 weeks later, she was off painkillers, and within 10 weeks, she was jogging and lifting her son pain-free. If pain is stopping you from living the life you want, grab my free chronic pain breakthrough blueprint at www.bodycheck.co.uk/free pain guide. It'll show you the 7 reasons you might be stuck in pain and how to start moving forwards.
Absolutely. Absolutely. So the thing that needs to change is the actual education, because we haven't changed. Do you consider that how they're taught by cutting the cadavers out and learning the parts? So if you're going to study the hand, you literally have an arm and that's it. So no wonder they compartmentalize everything if everything is compartmentalized. If you're not seeing it as a whole, then it's very difficult to understand it as a whole.
Yeah, I mean, in medicine, you get specialists, right? You specialize in a specific part of the body. But do you know what the definition of a specialist is?
Tell me.
It's someone that knows more and more about less and less until they know absolutely everything about nothing.
Yeah. Yeah. And I think that's why you and I are ever students, because it's like, I need to learn that, and I need to learn that, and I need to understand this, because then you can understand the whole picture. You know, I'm not a nutritionist, but I have background on nutrition where I can understand, you know, certain information about nutrition. And then if the person is, you know, needing extra, I'll refer them to a nutritionist or a naturopath. You know, it's kind of like supporting the system optimally.
Yeah, definitely. And, you know, there are so many aspects to the human body, not just, there's different body parts, but you've got the physical body, the emotional body, the mental body, the spiritual body. And, you know, again, let's use the example of frozen shoulder. Someone goes to see their medical doctor and they say, we'll give you a cortisone injection for that.
Yeah.
What's that solving?
Yeah.
Not solving anything. And it's actually, in the long term, making the tissues weaker in that area. Right?
It's interesting because frozen shoulder, a lot of it is emotional. Unless it's women of certain ages, it could be hormonal. But I would say 98% of the people that walk in through my door with frozen shoulder have something emotional happening at that specific time. And when I sit, and again, you know, it's no fault of the GPs, but they don't have time to sit and speak for 20 minutes with the patient. When I sit, we talk, we look at all the different markers, we understand what is happening in your life. And then from there, we work on what, you know, where, you know, you might be holding your shoulder like this because something's happening. And then the connective tissue, the central nervous system, the lack of breath, etc., causes, you know, a ripple effect.
Yeah. Again, just while we're talking about shoulders, do you see any common themes when it comes to the shoulder in terms of what might be going on emotionally?
Yes. Interesting. It depends on how deep you want to go with this.
I'm happy to go all the way.
Okay, so if you're looking at it anatomically, yes, it could be, you know, you're not breathing properly. It could be that you're holding your shoulders like this due to fear, due to anxiety, due to frustration, you know, you name it. It could be all of those. It could be that you had an injury when you were a child, and that injury has become your Achilles heel now as an adult. So your lymphatic system's not working properly, all the toxins are getting logged in here because of the ripple effect of an emotional turmoil. Because you have to remember that we're just a complicated cucumber, okay? Every time that we have an emotion...
I thought we were as a jelly bean.
Well, it depends on how you feel on the day. But if you think every time you have an emotion, you have a chemical reaction. every time you have a thought, you have a chemical reaction. So if you are concerned about, a parent or a friend or your job, and it's constantly ruminating, that's going to be causing a chemical reaction in your system. Let's say hypothetically that chemical reaction in your system is not clearing because you're not moving and you're not breathing. So then the ripple effect is that potentially the injury that you had as a child falling off a tree created a fascial adhesion, which then creates the problem of the frozen shoulder in the long run because of the emotions that you're producing. So it's kind of a double whammy. That's one potential. The other potential is energetic. So, for example, when you look at energy lines, because I work with energy lines, I see them when I work. So we have the energy from the earth that goes up into the system, but you also have the energy from above that goes through the system. So think about the system, the auric field with the 7 chakras. The body's divided into 4 quadrants. So you're divided like this and you're divided like this. Okay, so the right side of your body is your masculine. It's your doer. It's where we hold our frustration. It's where we hold our anger. The left side is your mothering. It's your creativity. It's your softness. It's your sorrow. So, for example, I tend to see a lot of people that have issues with grief. It's going to be on the left. Usually, it's not on the right. And the other factor when it comes to energy lines is that the ancestors, the male and female ancestors go through your neck. So the energy line goes through the back of the neck and in through the system. So if you're going to have an issue with a mother, for example, or a father, like, for example, I had a patient, we were working anatomically and then we worked energetically. Her energy line from her father line was going literally across here and lodging in here. And she had loads and loads of energy literally pouring into this shoulder. As soon as we started working with that, and we start working not only through speech, but through working with the energy, we were able to release the blockage and the pain left. So it's really difficult to say, okay, well, that person has an anatomical issue and that person has an energetic spiritual issue. They tend to go hand in hand. But, sort of shoulders, they represent also a lot of things. Shoulders, you carry the world in your shoulders. Your posture also has an issue. And breath, which is something I'm constantly banging on to patients. Breath is really, really important because breath moves the fascia, breath moves the lymphatic system, and breath moves the energy that's in your neck.
It's interesting you say that. I worked with a lady a long time ago now, and when she first came in, she had neck and lower back pain on the left. And so I kind of noted that. And the first time we started talking, I just said to her, I'm just curious, what's your relationship like with your mother? And she just went, don't talk to me about my mother. We've never got on. She didn't love me as a child. And she just went, and she was a really laid back, very calm person. And she just went off into this rant. And I worked on all levels with her, but one of the things we worked on was how to work on the relationship with her mother, who she hadn't spoken to for decades at this point. And she went back home, and about 6 months later, I got this letter saying, can't thank you enough. Not only is my neck and lower back pain gone, but me and my mother get on like a house on fire. We see each other every day.
Oh,
right?
Oh, that's amazing.
Yeah, but it shows you how interconnected the human body is, because it was again, pain for me is the subconscious making the conscious mind aware of something. So her neck and back pain, unbeknown to her, was telling her she needed to heal the relationship with her mother. And the other thing with neck and obviously shoulder, fifth chakra is also communication.
Yeah.
So left side female, fifth chakra communication. That's why I just asked the question. I wasn't thinking, oh, she's got left side neck pain, she must have an issue with her mother. I was just curious. Could that be the thing that's going to unlock the door? And it turns out it was.
Mm.
You know?
Absolutely. Absolutely. And this is why talking and sharing with a patient, sort of what's going on in your life, when did the pain start? What was happening to you at the time that the pain started? You can really analyze to an extent where the system is and what's happening to the system.
Mm.
The system being the body. I call the body the system because it's an amalgamation of systems all working together and moving together and ever evolving, ever changing. And yeah, I agree with you. I mean, I think the body, if you look, sort of at Chinese medicine and how the organs represent emotions, if you look at how different parts of the body represent emotions, you can see it through the chakras, you can see it through the throat, you can see it through, sort of thyroid issues, whatever, sort of it's a question of investigation.
Yeah, absolutely. Absolutely. So whilst we're talking about kind of unresolved emotions, can you explain how they get, if you like, lodged in the body? Like how does that process happen? And what other ways can it potentially manifest physically, such as IBS or chronic pain?
Okay, that's quite a challenging, big question. Okay, so as I said before, everything that you see, think, hear, taste creates a chemical reaction in your body. So if we begin by just looking at the basic chemical reactions and the anatomy without the spiritual side of things, without the energetic side of things. If you, for example, if you're a very angry person or a very frustrated person, it's likely that your liver is going to have issues. And if your liver has issues, it means that it might have too much energy. And if it has too much energy and you don't address the energy, the build that it's having, then it starts impacting other organs. So that's one way that the system can be impacted. Lack of breath, lack of movement impacts the system as well, because if you're not clearing your lymphatic system, and this is why I mean by systems, you need to look at all the systems, and all the systems need to be working optimally. So if you're a person that doesn't drink much water, that means that the fascia is not going to be moving, which means that your lymphatic system is not going to be clearing optimally. If that happens, then that's going to potentially be giving you gut problems. And if that gives you gut problems, then it becomes, again, a ripple effect. What was the other thing that you were asking me?
Yeah, so what's the process of how unresolved emotions get lodged in the body, and how does that potentially manifest into conditions such as IBS or chronic pain?
Okay, so the chronic pain issue is, as you were mentioning before, is just your body telling you that something is not in alignment. If we're looking at it anatomically, we look at the chemicals. If we're looking at it energetically and through the chakras, there's two levels. So the chakras, each chakra has a representation. So for example, as you said, throat chakra is how you communicate to the world. The heart is how you feel. The solar plexus, sorry, I'm going about it the wrong way. So let's start at the bottom. You have the root chakra, which is the one at the bottom. And that's the one of whether you feel like you belong to this earth. whether you have safety. Then you have the sacral chakra, which is just above, which is just below your navel and your pubic bone. That one is your creativity, your sexuality. So, for example, if that's deficient, you're going to have issues potentially with fertility. You might have issues if you're a woman with your womb or with ovaries or with your period. But that could be also impacted not just because of your femininity or lack of, it could be lack of creativity. And creativity could be something as simple as, are you enjoying life? Or is your life just solely work?
Mm.
Then you have the solar plexus, which is above. The solar plexus is what gets activated from the sacral chakra. So it's kind of a stepping stone. Those three, the lower ones, are the human chakras, and they're very related to the gut. So if there's an imbalance in the gut, you need to basically ask yourself, okay, well, what's happening within those three chakras? But because you have the three chakras are the energy from the earth going up. The energy from your parents goes through the three chakras, but it's not yours. It becomes from your ancestors. So it goes across like this. It surrounds the chakras. It goes through the chakras, but this is what I mean. It depends on the imbalance. It's quite complex. It's quite easy, but quite complex. So if you break it down and you're looking at the three main chakras at the bottom, you can work out to an extent what the deficiencies are within the organs, depending on those three. Then you have the heart chakra. So the heart chakra is where we hold our emotion. It sits within our lungs. So if you have a lot of sorrow, you might have breathing difficulties. You might have asthma, for example. That's a great example of somebody who has a lot of sorrow. But interestingly, people will say to me, yeah, but I was born with asthma. And I'm like, okay, so then let's go back and look at what was happening to your mum when you were pregnant, or when she was pregnant with you. What was happening in the household? Because usually you can identify going backwards why you have asthma. And it's not necessarily that you're just allergic to dust mites. Then we have the throat. Then we have the third eye, and we have the crown chakra. So from those 7 chakras, you can analyze a lot of different emotions. When it comes to chronic pain, it really varies as to where the pain is, whether it's in the viscera, as in the bag of your organs, whether it's in a body part, whether it's in a joint. A lot of our energy flows through the joints. So when the joints are hurting, is because the flow isn't working properly. If you look at meridians, which are the Chinese meridians, again, you can follow the line and kind of say, okay, well, the heart meridian is being blocked. It doesn't necessarily mean that there's a problem with your heart, but it could be that you have an emotional blockage. And that emotional blockage is then causing pain. It could be as simple as pain in your arm, or it could be pain in your shoulder, or pain in your heart. So did that cover everything that you needed?
Yeah, I think so. I think we pretty much got there. So something you mentioned earlier was the Biofield.
Mm-hmm.
Again, for someone that maybe hasn't come across that, can you explain what that is, and also what role does it play in our health, and how can imbalances, whether emotional or ancestral, impact our well-being? One last quick break to share Josie's story, because sometimes we get so used to pain that we forget what freedom feels like. Josie had been suffering from carpal tunnel syndrome for over a year. She'd seen a physio for 12 months, but nothing seemed to help. It disrupted her work, sleep, and day-to-day life. She felt worn down and, honestly, a bit hopeless. But after just 3 sessions, her symptoms were nearly gone. She called it a miracle. I call it the power of finding the real cause. If you've been putting up with pain for too long, don't wait another year. Download the free Chronic Pain Breakthrough Blueprint at www.bodycheck.co.uk/free pain guide and find out what might be keeping you stuck.
Okay, so the biofield is a more professional word to say the auric field. A lot of people call it woo-woo, but the biofield is basically what MRI scans can see. If you didn't have a magnetic field around you, you would not be seen on an MRI. So that is what the biofield is. And the biofield comes out of your chakras. So the 7 chakras have energy that flows out and flows in. And that basically surrounds the body. Some people say that it surrounds the body and the body sits within it. I don't see it like that. I see the body moves around it. So if I were to grab my pen, imagine that this is your spinal cord. I'm going to do an angle from here. If you are centered, the spinal cord will be in the center of your biofield. But if you're a person that lives your life in a hurry, you're forwards of the biofield. So that will cause an imbalance in the biofield because you're too forwards. You're too much, the energy is flowing forwards and it's causing an imbalance in the actual field. Now, the field itself is similar to fascia. Fascia is layers and layers, thousands and thousands of layers and layers and layers on top of each other. If you look at certain cadaver videos, you can see how they can be just lifted individually. Now, the biofield is exactly the same. It's thousands of layers of vibrational atoms. And they're constantly moving. It's not like you see it in drawings that it's just a nice circle surrounding the human. They're constantly moving just like the fascia moves, just like the lymphatic system moves. Now, if there's an imbalance, it could be an imbalance in one layer rather than all of them. In the same way as there could be an imbalance in the lymphatic system or the cardiac system rather than all of them. When it becomes all of them, then we have a proper disease, like cancer or MS or something like that. In my opinion, and I might be burnt at the stake for saying this, but I feel that every disease is curable. But it just depends on how we approach the biofield and the human matter. If you think of us as atoms, we are matter because we are solid, but the biofield is also around us because we're made of atoms. So depending on how that flows, depending on how the emotions are, and I'll give you an example. I was working with a lady. I always finish at the feet because I can see everything neatly. And I remember watching, this was years ago, I remember looking at her and I was very confused by what I was seeing because I was seeing that her body was on the couch, but there was various layers of her that were falling off the couch. So half of her biofield was falling off the couch. And the best way I can describe it, it looked like mozzarella. It looked like literally half of her was dripping. And I was very confused by what I was seeing. I continued working. I kind of asked the system to kind of gather itself up together. And the system, sort of realigned beautifully. And at the end of the session, I looked at her and I said, okay, this is going to sound really crazy, but you were being cut in half. There's a division and it's coming from your left. And she looked at me slightly horrified. This was at the beginning of my psychic ability and she wasn't aware that I could see the way I do. So she looked at me slightly concerned and said, look, I've got to go. So, she left. We didn't continue talking. And then literally an hour later, she emailed me. And she said, the reason I had to run away was because I was really shocked by the words that you were saying to me, because I am torn, because I used the word torn. She goes, I am completely torn in my life at the moment. I'm going through an incredibly hard time. I have fallen for somebody else, and I'm really struggling. She was married, and I'm really struggling with the decision. And I am just breaking and feel completely exhausted with it. So if you look at the image that I saw, it kind of explained to me what her biofield, not her matter, but her biofield was feeling.
Mm.
And then at the end, when, sort of the next day I texted to say, how you doing? She goes, I feel so much more together. I feel so much more solid. And it was because that needed to be acknowledged, how she felt. She needed to have the safety and the space to be able to say, you know what, I am completely torn and I'm exhausted and I don't know what to do. And she had nobody to talk to.
Mm.
So that's an example of how the biofield works. That was just one of her layers expressing itself to me. But bear in mind, this is how it expresses to me. Different people see different things.
Mm.
Some people see color. Some people see holes in the biofield. So different people have different abilities. My ability is not, it doesn't work for everybody. But we all get the same result in the sense of we're able to express what the biofield needs to say.
Mm. Yeah, I was thinking earlier, actually, I was going to ask you, do you see the biofield? That was going to be one question, which you answered. And then the next question was going to be, what you see, is it similar to what you might see on Kirlian photography, for instance?
Interestingly, what I see, I'm just going to see whether I can find, oh no, my phone's off. I'll send you a video of how I see it. For me, it blows my mind every time I see it. It's exciting because it's so bizarre. I don't see it like that photography that you're talking about. I don't see color because because I get so much information, color would be too much. Because I get images, but I also get sensations and I also feel the pain physically. So I hear things, I sense things, I see things. When it comes to seeing the energy, I see it like, when you were a kid and you used to have those little metal games that you could put a magnet and the little hairs of the magnet would move.
Mm.
Do you remember that?
Mm.
Okay, so it's kind of like that, but it's liquid. So I see the movement of the liquid of the body, and I see it in different quality. So it could be like full on light, like when you see those images with really strong light. But I see it all in black and white. It's different textures. That's how I see it. I have friends that see it in color. They literally can see the different auric chakras, and they can see when there's a hole in the field and how the light is shining through. So they can see the imbalance within that, sort of hole.
Mm. Yeah, I find all this stuff really fascinating, and I know a number of people that can see similar things to you, but maybe in slightly different ways. I tend to feel things. I don't hardly ever see anything. There have been times when I've been on courses where I don't know, did I see things or did I feel it? I'm not sure. But I remember being on a course, again, some time ago, and we had to look at someone lying on a treatment table with our eyes closed, and we had to scan their body. And we were asked to identify areas of tension in the person's body, looking at them with our eyes closed. Yeah. And then what we had to do, we had to then actually palpate the body and see if it matched what we saw with our eyes closed. And I was completely blown away. And it wasn't just me, it was everyone in the class was able to do it pretty much 100%.
If you are an anatomist, as in if you know your anatomy, I love, for example, I only work with my eyes closed. I can't work with my eyes open because I see too much, if that makes sense.
Mm.
I have to work with my eyes closed to be able to see the layers. And if you know your anatomy, you can literally work through and you can develop this skill. This is how I developed it. You work through the muscles, you work through the organs, you work through seeing it in your mind's eye, and you can see the blockages, just as you just said. You can see the blockages. And then the more you do it, the more you'll understand the patterns, if you know what I mean. So you'll understand, oh, yeah, I recognize that from before. So that must have a sense of X or have a sense of Y. So when you say that you sense it, you feel it, do you physically feel it?
I tell you what does happen sometimes, and I know this is something that, Reiki practitioners like, oh, you didn't protect yourself or whatever. But sometimes I'll take on a client and let's say they've got pain in their left knee. I'll experience pain in my left knee, but it will come in and then it will go.
Mm-hmm.
It won't stay there. But generally, so I've often had situations where clients have come to me and I just get this feeling of something that happened to them in their early life. And I generally don't go there, certainly not initially. But then several weeks, months later, they will bring it up in conversation. And I'll just mentally say to myself, obviously not out loud, but I already knew that,
You need to start embracing this. It's
Yeah,
funny.
no, I mean, I'm not against it or anything like that. It's not something that I know how to tap into consciously. It just happens or it doesn't happen. Some people it just doesn't happen. Some people it just happens.
But it's like working out. Genuinely, it's like going to the gym in a intuitive way. The more you practice, the more you trust it, the more it comes up.
Mm.
For me, so many times when I first started this, sort of the seeing, the clairvoyant side of things, it was very much like, can I say something? I'm not sure. And then I started saying it and trusting it. And the more I trusted it, the more information would come through. I, like you, I also feel it in the body, but you have to be very careful because when you're feeling it in the body, you have to stay grounded because otherwise it stays in you. And that's what makes people sick. That's why makes a lot of therapists sick. Is that, sort of remember, we're a biofield. So just because you are feeling their resonance, that resonance can stay with you if you're not clearing it. And it's one of the biggest things to do with when you're doing this kind of work is you have to be grounded before you begin. And you have to clean yourself, just like you have a shower, you do the same thing energetically. There's a lot of people that do it differently. They use sound, they use Palo Santo, they use various different things to cleanse,
Sage.
but it's in your auric field. And I remember part of the reason why I ended up doing craniosacral therapy was I had a lady who kept coming to me. She was in her 70s. She had a heart attack. And every time I worked with her, I would start my day feeling fine and I would finish literally grey. And my husband looked at me and she goes, you can't continue doing this because it's going to kill you. I mean, literally the last time I had treated her, I sat on the sofa after work and she was my last. I always put her last. And I couldn't move. I could not get up from the sofa for about 5 hours. And I said to myself, okay, I have to find a way to do this without being flawed. So I trained with Thomas Attlee at the Craniosacral College in London. And he was amazing because his type of training is very much this. Up leisure. I train with up leisure as well, but up leisure is much more anatomy centric, which is fine, but I wanted more of the other side because I was struggling with the other side.
Mm.
And he taught us how to basically create a fulcrum, how to really connect and how to be able to see without getting sort of thrown into the fulcrum of that person, if that makes sense.
Yeah, absolutely. Absolutely. So when we have disruptions in the auric field or energy system, how does that relate to conditions like anxiety and depression?
The auric field itself, it depends on whether you have a leak, as I would call it, which is basically your energy is flowing in the wrong way. If you have a leak, you're basically going to feel exhausted and you're going to feel very down, very depressed. When it comes to the different layers, the system itself, it's really interesting because when you touch a person that is depressed, you immediately feel it because their system, their body is really heavy. So the energetic field it just drags you down. So what you need to ask the system is kind of, first you need to find out where the blockage is or where the leak is. And then we need to ask the system to kind of lift, to come up from the sinking. But it's very interesting because it's quite difficult to describe because you're looking at different layers. Sometimes you will have a layer that is literally below the couch. And it's asking the system, what do you want to do with that layer? One of the things that I've learned through my career and working, especially as a clinical massage therapist, is you want to fix the person. You want to fix their pain. You want to heal them in some way or other. And in reality, part of their healing is to go through the process. So it's really important that they do the work, not that you do the work. So when you're asking, okay, you have this leak or you have this layer that's completely off your system, how can you put it back? And you ask the system in your head, we need to put you back in. And I'll give you an example. I was working with really beautiful, beautiful human, really lovely lady. She had a horrific birth of her first child. And she came to me, she literally, you touched her, she felt broken, like totally broken. And I remember working with her and suddenly I see this layer that is, not joking, her body's here on the couch, the layer is here. It was literally trying to come out of her system. Years ago, I would have gotten rid of it, cut it, done something. But I've learned through the years to ask the system, hey, have you noticed that you've got this going on? Do you want to come back in or do you want to go out? And as I say that, her layer literally just slowly went back in. And it reminded me of, when you have an outer body experience, that you have the spirit of the human kind of stepping out. I think one of her layers, literally because of the such pain and trauma that she went through, had an outer body experience, wanted to leave her body. And as soon as I asked, I think her system hadn't noticed. And when it went back in, the whole system it just relaxed. It was incredible. And she phoned me the next day. She goes, I feel like a complete different human. So that's an example of the layers. Sometimes it could be very simple around the auric field, an issue within the auric field. It can be an issue within the chakras, but it could literally be that you have a layer that has completely left the building and that you need to realign it somehow.
So what you're saying is if someone's got anxiety or depression, there's more than just taking pharmaceuticals to solve the problem. Although they wouldn't solve the problem, they might at best, suppress the symptoms.
100%. 100%. I believe that pharmaceuticals are useful. I'm not one of these holistic therapists that says you shouldn't take anything. I think everything is needed depending on what the situation is. So, for example, I deal with a lot of oncology cases. I would never in a million years say to somebody they can't have chemo. If you are so depressed that you cannot function, then I believe, take your antidepressants just to allow the system to reset and give you a little bit of breathing space so you're not drowning. And then once you have that breathing space, then don't depend on it. Don't just say, okay, well, this fixed it, because it hasn't. It's just giving you a breathing space. It's giving you a space in the in-between, what I call the in-between. Now, when you have that in-between, then you have a moment where you can say, okay, well, what's going on in my life? How can I change it? What's my diet? What's my routine? What's happening in my job? Or is it my kids? Or is it my marriage? Whatever it may be. And then address it. And many times they can address it and then just slowly take the tablets down. But I'm not going to say to somebody not to take antidepressants if they're suicidal, for example, or, sort of if they're in a really dark hole. You have to be a very strong character or a very particular character with a lot of scaffolding to be able to, internal scaffolding, to be able to deal with a manic depressive episode, to be honest.
Yeah, I've actually had a client come in to see me once. He came to me for exercise. He had clinical depression and he found that exercise really helped him. And he came in one day and he just walked straight by me and just stood in the corner. And I'd say, are you okay? And he couldn't even look at me. He couldn't connect with me. He was just kind of slumped in the corner. And I was thinking, well, do I need to call an ambulance? Like, is this guy going to try and do something stupid right now? And it was pretty frightening to see. And, he was saying, look, my prescription's pretty much worn off. That's why he was like he was. And the next time I saw him, he just looked like a normal human being. Right. And I would say the medication he was on was literally keeping him alive.
Yeah.
Just checking in with another real life story, because sometimes it's not just about pain, it's about what the pain is costing you. Nick loved running and playing golf with his sons, but standing all day at work left him with chronic back pain. He couldn't play, couldn't train, and felt like he was watching life from the sidelines. We scaled his training back, focused on what his body needed, and just 8 weeks later, he was pain-free, back running, and back out on the golf course with his boys. If you miss the life you had before pain, download my free chronic pain breakthrough blueprint at www.bodycheck.co.uk/free pain guide. It's time to start writing a new chapter.
Yeah. And that's why, as I say, it really depends up to the person. And it depends on the process that they're going through and whether they have the space. I mean, I went through a very strong few years after my father died. I was adamant I didn't want antidepressants, so I didn't do it. But I have the infrastructure and the know-how and the people around me that I can lean on. As a therapist, I refer many people to many different people. So therefore, I had the support and I didn't have to work in an office, and I could take the liberty of reducing my hours. I don't know how I would have been if I was working in an office and I had my 2 young children and all the pressures on top of that. I think I probably would have ended up taking antidepressants. And I think they're a great invention, but not to become dependent on them. I don't believe that, it's the same as painkillers. Sort of you need to, with a painkiller, you can have painkillers specifically for nerve pain, for example. And if you take them, they give you the respite so that your body's not looping. If you can have that so that we stop the loop, then we can start healing. But sometimes when you're in so much pain, your body's in crisis mode. So it's producing more inflammation, which then is producing more issues. So it kind of applies to the same thing, or at least that's how I view it. It applies to the same thing.
Yeah, yeah. So earlier on, I said we'd come back to talk about the psoas. So
The muscles.
we're at that point now.
Oh.
Now, I remember reading a book, again, many years ago. I think it was called something like The Psoas, the Emotional Muscle, or something along those lines it was called. I know you call it the fight or flight muscle. What would you say its relationship is to stress, trauma, and gut issues, like you mentioned IBS?
The psoas muscle, I love the psoas muscle. It's a very understated, underloved, and undertalked about muscle, to be honest. The psoas muscle basically is one of the biggest hip flexors. It attaches internally. So imagine that this is your spine. This is where the diaphragm ends. This is the lumbar spine. So it attaches usually L1, L2, L3, or 4, or it might attach L2, L3, or 4, sort of basically the lower back. And it comes through you like wings, and then it goes in and attaches to I'll show you. I've got a lovely image. So it attaches to the leg bone here on the inside.
Yeah, yeah.
And as this beautiful image describes, it has the 3 chakras, the human chakras, or what I consider the human chakras, which are the 3 lower chakras. Okay.
They're also known as the reptilian chakras as well.
Very good. Yeah, exactly. So you have the vagus nerve comes out of the brainstem, and a huge solar plex bundle, which sits within the solar plexus and sits within the psoas, gathers. Okay, so it's kind of here. It gathers all in there, and from there it then goes into the organs and into the legs and so on and so forth. So the psoas muscle gets activated by fear. It gets activated by basically most of your thoughts. It gets impacted, obviously, if you're a cyclist, if you spend your life sitting down, if you're a runner, all of those exercises or lack of impact the psoas muscle. But energetically and emotionally, if you think about the fact that all your nerve plexuses sit, or not all of them, but a big bundle of nerves sit there, as well as a huge bundle of lymphatic systems sit there. So loads of nodes of your lymphatic system sit there. So that in itself can impact the digestive system in different ways. So if you consider that if your lymphatic system's not working properly, it's going to impact the digestive system. If your central nervous system is what I call on fire, because it's the I can't speak. Freeze, flight, response. That's not how I mean it, but you know what I'm trying to say.
Yeah, fight or flight response.
Thank you. That gets activated within the gut. And if your psoas muscle is really tight, and it can be tight on the left, it can be tight on the right, or it can be tight on both. So, for example, somebody who's quite angry or frustrated or stuck in life, the right side usually will be really, really tight, which can impact the hip, and it can impact the liver, and it can impact basically the gut. The gut is always going to be impacted by the psoas, because as we walk, the psoas moves and it helps with peristalsis. So it helps with the digestion, with the gut movement. If we don't breathe, because as we breathe, the diaphragm does this and the pelvic floor does this. So it's kind of being massaged when we breathe. If we don't breathe properly, that impacts the psoas, which then impacts the peristalsis, which then impacts digestion. Pain-wise, again, the psoas can really affect the hips. It can really affect the lower back. A lot of people underestimate it. They don't really assess it. They don't really look at it. I've had so many patients that come in and they say, "Oh, my GP says I have a slip disc." And I'm like, "Have they checked? Have they given you a scan?" They go, No. It's just really painful." And I'm like, "Well, why don't we just have a look and see whether it's the psoas?" So you have a look whether it's the psoas, you release the psoas very gently, and then the person walks out without, a bit of discomfort, but not, crutching over and unable to move. The only thing about the psoas that every therapist needs to be really, really, really mindful is that if you're going to release the psoas holds all the emotions of the soul, literally. So if you're going to release the psoas without being mindful and without actually asking permission from the system, you can put that person into a huge set of troubles. They can go into a healing crisis. They can have issues with their lumbar spine. They can have issues with their central nervous system. So, sort of be really gentle with releasing that. I've noticed with occipital release as well as psoas release, therapists are really easy they just want to go, "Oh, I want to try it out. I want to release it. It's great." And it's like, oh, be mindful, because if you're going to do that, you can throw somebody into a depression overnight.
Yeah, I remember when I was at massage school, we were working on the psoas, and so I partnered up with this colleague, and so I'm working on the psoas, and I can't remember why, but the instructor came over, and she started working on the psoas, but she went like twice as hard as I did, and then my colleague on the table starts crying her eyes out, and the teacher just walks off.
Wow.
And I was like, "Oh, okay." I mean, I kind of knew. I knew about the psoas at that point anyway. And I just thought, okay, leave me to deal with the mess, But obviously, I don't know. I don't know if I would imagine the instructor knew about the psoas. But yeah,
I imagine that she did that to put you in that position for you to learn to handle it.
Maybe. Yeah, maybe. But I mean, I was already used to handling people crying in front of me.
Yeah.
That's just when I tell them my jokes. But yeah, I went through a period of time where, I always had to have tissues in my consulting room because so often people would be crying. But I never saw that as a bad thing. I saw that as, most of the time, as actually a good thing. It means that they're trusting in me, that they can be open and honest and let their emotions flow.
Mm.
And also it's part of the healing process.
Absolutely. It's a great way to shed all those chemicals. As I say to a lot of my patients, is kind of, if you're going to cry, don't get hung up on it. You're just shedding all the chemicals that you were feeling at a point in time that were lodged in your system. Because many times, especially with craniosacral therapy, you're working with somebody and then they start bawling and they're like, and then they stop. It starts and it's just immediately stops and they go, "What happened? What was that?" And I'm like, "We're just working through just stuff that doesn't need to be there anymore." But yeah, the psoas muscle, I love the psoas muscle. It's a beautiful muscle, and, sort of how it sits within the pelvis. When you look at, how it sort of weaves itself into the iliacus, all of the muscles there are really magical, and they can really, when you work with it in a respectful way, you can really help heal a lot of people. I remember many years ago, I've worked with two people that have had broken backs. And one of them, it was amazing because I remember I was trying to release the viscera of all of her abdomen. And I'm holding the psoas muscle from behind, and then I have my hand on her tummy. And suddenly she starts vibrating. And I'm not joking. She is shaking. And her legs are shaking. And I'm like, are you okay? And she starts laughing because she looks at me and she goes, I'm absolutely fine, but I don't know what this shaking is about. And basically what was happening was we were releasing the shock that was in her system from that car accident that she had. And it lasted nearly 45 minutes of her literally just the whole body just shaking, like insanely. But her talking to me like I'm talking to you, absolutely fine about it.
Yeah, I experienced that a lot when I used to practice the body talk system. So you'd release a certain emotion. It might be phobias sometimes. People had phobias. Like I remember clearly I was working on someone who had phobia came up of spiders. And we started off just saying the word spider. She was like, oh, no, don't even say the word. Don't even say the word. And then by the end, I was literally like crawling my hands over her shoulder. It's like, oh, this is a spider. And she was like, yeah, and I'm fine. But when I was doing the tapping to release the emotion, what was interesting was her her upper body was completely still. It was just her legs was just vibrating. But other times, like you said, it's literally the whole body goes into like convulsions.
But it's interesting that you say that her legs were going off and not the upper body. And that's basically the fight, flight, freeze response. That's her trying to run away. So it's the subconscious mind and the layers of the subconscious kicking in. And it's like, I've got to run. I've got to run. So and this is the beauty of fascia and the energetics, because fascia is like crystallized suit that holds all our emotions, like everything from the beginning of time. So when you're working with fascia and then you add the energy into it, it's really powerful. It's really, really amazing what you can achieve and how people can heal, as you say, from something as simple as a phobia.
Yeah. I remember I did another session on a friend of mine. He had a phobia of dogs and he had a similar reaction. And then he didn't have a phobia of dogs anymore. It's gone.
Amazing.
Yeah.
Amazing.
So moving on from that, can you explain what the 5 osteopathic diaphragms are and how are they connected to breath? And how does working with the 5 diaphragms support healing from pain, anxiety, or digestive issues?
Great question. Amazing question, because a lot of people don't even know that we have 5 diaphragms. The 5 diaphragms, everyone knows about the respiratory diaphragm. Now, a diaphragm is basically considered something that separates one thing from another. Okay? So the pelvic floor is a diaphragm. The respiratory is a diaphragm. Then we have a diaphragm here, which is basically at the base of the neck. So if you were to hold your breath, you can pull in here. That's what you're pulling. That's the diaphragm you're pulling. Okay. We have one here, which is the larynx and the tongue, which is basically, again, you can block it off when you're doing certain yoga breaths. You can literally learn to close it. When you're breathing to close the diaphragm, you can pull them all up or pull them all down, especially when you're doing Kundalini yoga. When you're doing that type of breath, you'll be able to feel all the diaphragms. Now, the one that people don't talk about is the one that's in here. And it's basically, let me get you a little model. Stay there for a second. So the skull, it's not a very good example because it's made of paper, But we have the tentorium cerebelli and the forks cerebellum. I can never say the word. Cerebri. Anyway, it sits like this.
You should be good at Latin words, really.
Not really. Not when there's X's and, things like that. So you have the right and the left hemisphere of the brain. Okay. This is a type of diaphragm that sits and attaches itself in here. Okay. And then, so these points where my fingers are kind of where these 2 points meet. And it sits like this. It's not brilliantly designed because it's designed by paper. And then this attaches itself to the front of the skull. And then it attaches itself to the back of the skull. And then the bottom is where the brainstem comes out. Okay? So in here...
So for those that are listening, basically, it's in the skull.
It's in the skull. However, you have the tentorium, which is like a little tent right at the top. And that's where, sorry, I forget this is a podcast and you have people listening, not watching. However, you have a little tent in the center of your brain. And that little tent holds the pituitary gland, and it's where your hypothalamus is. So if you consider that every time you breathe, you're moving the diaphragm, you're moving the pelvic floor, you're moving your throat, and then above that, with the breath, you're moving the actual tent that is in your brain. And by doing that, you are creating movement of the cerebral spinal fluid. By creating movement of the cerebral spinal fluid, you're cleaning your brain. So it's really, really important for the brain function and to be able to focus, to be able to stay alert, to be able to manage anxiety, depression. All of that is held within the toxins of your brain, number one. Number two, breath, we are 3D, so we don't really breathe into the back of our body. If we're able to breathe into the back of our body and use every single diaphragm that we function with, the body would work optimally in the sense of all the systems would be able to go up and down and expand out and in. If we're doing that on a regular basis, we're resetting our central nervous system. So it's basically saying you're safe, everything's fine. Your cardiac system works optimally. The lymphatic system is cleaning. If you consider that we have 2 diaphragms, one above and one below the neck, and we have a massive amount of nodes, of lymph nodes in the neck, every time you breathe, the lymph nodes are clearing and going into the cardiac system to clean itself. So basically, overall, breath is really vital. Whatever type of breath, it doesn't have to be Wim Hof, it doesn't have to be an hour, it doesn't, so you can do those are great. But just really focusing on breathing into the back of the body is really, really vital for our day-to-day. And we tend to, if you ask somebody to breathe, they tend to breathe into the front of their lungs and they go up, which causes more anxiety.
Mm. Yeah. Yeah. So to sum up the answer to that question, your breath is very important, and to breathe correctly.
Vital.
Yeah.
I mean, sort of breathing through the nose is really important, but there's a lot of mouth breathers out there that they can't help it. But if we make a conscious effort, if you're a mouth breather, just to imagine that you can breathe through a slightly larger straw and you send the breath to the back of your lungs and the back of the heart, then you become 3D. I give the exercise to a lot of my patients is to breathe into the back of the heart and to do 4 breaths. That's basically, you can do that at different stations. I give them little post-its that they need to put around the house. And stations are by the kettle, by your toothbrush, by your bed, by the toilet roll. And all you need to do is 4 so that you start getting accustomed into breathing 3D. If the person is unable to breathe into the back of the heart, because some people find that very challenging if they're not good breathers, I give them the idea of, imagine that you have little holes in your armpits and you're breathing into your armpits. Then that makes you 3D sideways and it expands the lungs fully. And then slowly you can start working towards sending it to the back. So, but it's baby steps.
Mm. So when you say holes in the armpit, you mean like nostrils?
It could be holes, it could be nostrils, it could be gills.
They will only work underwater, though.
I don't know. I do it all.
So one more question for you.
Sure.
So with all these layers, so we've got fascia, we've got emotions, we've got energy, and we've got the breath. What would be the best way or the first step that you would recommend for someone looking to heal from chronic pain, stress, or IBS?
I would say 2 things predominantly. Breath is 1, 100%. And 2, learn to be embodied. What I mean by that is learn to feel your human system. So some people meditate, some people go for walks. When you are living in the now, and I mean, sort of not going for a walk and thinking about your to-do list, but literally living in this moment right now and trying to center your system. Like I was saying before, that you have your auric field could be forward of your body because you're too busy.
Mm.
And when we're forward of our body and we're too much in our mind, we disconnect from our system. So if we can reconnect to our system in whatever format, it could be swimming, it could be even sleeping before going to bed. You're lying in bed and scan your system. Start at your feet and go all the way up, go at the back of the body and then go to the front of the body and scan it, see what it has to say to you. Because part of the reason that we have issues is because we don't understand the language that our body is speaking. And if you can learn to hear the whispers of your system, you can heal.
Mm. Yeah, I like that. And, there's a good reason why breath was at the top of the Czech totem pole for many years, right? I mean, psyche is now above that on the system, but yeah, it does emphasize the importance of breathing on our. I mean, yeah, most people might think, well, of course, breathing's important because if you didn't breathe, you'd die. But there's ways of breathing, right?
There's ways of breathing, and if you don't believe in all the stuff, just consider that your fascia only moves with breath.
Mm.
And fascia is where your entire central nervous system sits. So if you're in pain, you want that fascia to move because you want it to clear itself of toxins. You want it to actually not have the adhesions that it would have. And it's interesting that you say psyche is at the top of the list and not breath. And I disagree with that. Because I find that we're all in this quest to go up and go higher. But you can't go higher until you heal the base. It's kind of like creating a building with no foundations. If you don't have foundations, your building will collapse. It might look really pretty at the beginning, but it will collapse. So actually working with the root, the sacral, and the solar plexus, which are the human chakras, because we are human, actually working with those and balancing those will allow you to be centered and then go higher. But if we are just going up, what's going to happen is that depression, anxiety, IBS, and all those issues will be actually worse if you don't have the foundations of the lower.
Yeah. Yeah, the Czech totem pole is prioritized on survival. So the reason psyche is at the top is because technically, if you didn't want to live, you could kill yourself, right? So, but other than that, breathing comes first, because without breath, there's no life anyway.
Yeah, absolutely. Absolutely.
Yeah, I mean, one of the difference between someone who's alive and someone that's dead is breath.
Yeah, absolutely. And with breath comes the energy field. You know, sort of that is what activates us as humans. When we're born, we take the first breath. And that's what activates every single layer. And if we don't breathe, then our layers aren't functioning.
Yeah. Yeah. And, and as you said, stress affects your breathing.
Absolutely.
Yeah.
Stress, anxiety, and this is the catch-22. If we're stressed, we're in our mind. If we're in our mind, we're not in our system. So if you can put the Post-its around your house or in your office or in both, then you can be stressed. But every breath, every time you take those 4 breaths, it brings you back in. And when it brings you back in, what happens is that breath allows you to be in the in-between. Again, I say the in-between. And the in-between gives space to the problem, gives space to the issue that you have, gives space to reality. And to be in the in-between is where we can actually differentiate to become what's happening and become our own observer. And to be able to heal, we have to be our own observer. Because otherwise you can't see the wood from the trees.
Yeah. Yeah. Awesome. That's a great way to wrap up the show. But before we do wrap up, what's next for you, Margarita? What have you got in the pipeline?
Oh gosh, I've got so many things. I am designing programs. I run workshops. I run very small workshops in my home. And I'm just about to launch my first free one on next Wednesday. And I'm planning to do more. And I'm also in the process of creating some kind of online support for individuals that want to get in contact with their own intuition. So understanding how to connect to that intuition, understanding how it feels and how to connect to the quantum field, basically. So yeah, all very busy and very exciting.
Yeah, sounds good. And where can people find you online?
They can find me on Margarita Bennett. .co.uk, which is my website, and there you will get all the information you need. I also have LinkedIn and Facebook and Instagram, but I'm only just starting to use them for business. I've never really needed to, so I'm not into the internet. I don't like it. It's kind of a love-hate relationship at the moment.
And definitely not to get mixed up with Margarita Plagatan.
No! Definitely not. She, as I said before, she ruined my name. I prefer for people to think of me as a flower. Margarita's a daisy. And it's definitely much nicer than that loud, really cringeworthy human. But I think, as you mentioned, I think she's passed away. So
she has.
So, you know, I wish her well wherever she's gone.
Yeah. Yeah. Awesome. That's a great way to end up the show.
Thank you very much for having me. It's been an utter pleasure. I didn't realize we were going to talk so much about energy, and it's such a nice feeling to share so freely about that side of things. I've always been very focused on the clinical side and, you know, oncology and chronic pain, but no one's ever really tapped in and spoken to me about the energy field and the intuitive psychic side of me. And it's a real pleasure to share.
Well, it's an important subject to talk about because we are energy.
We are, absolutely.
Yeah, and we can't ignore it.
Yeah, atoms vibrating through time and space.
Absolutely. Absolutely. So that's it from Margarita and me for this week. But don't forget to join me, same time, same place, next week on the Radical Health Rebel podcast. Thanks for tuning in. Remember to give the show a rating and a review, and I'll see you next time.